In this episode of Full Strength Spotlight, physical therapist Dr. Michelle Goto explains why bone health matters after menopause and how the right exercise can support long term strength. Why does bone health become such an important conversation in midlife, especially for women after menopause?
Decreasing bone density, or also known as osteopenia or osteoporosis, can be especially common in women after menopause as their hormone levels change. And this can be dangerous just if it puts us at increased risk for falls as we get older, or increased risk for fracture with falls. And so we want to try and reduce that as much as possible. And so as soon as people are, especially women, are approaching that stage of life, we want to make sure that we can prepare them to reduce this risk of fracture by improving their bone density and just giving them the strategies that they need in order to continue to have their strength throughout the rest of their lifetime.
Is there a difference between exercising for general fitness and exercising specifically to support bone health?
There are specific exercises that can be more effective for building bone density. These are specifically exercises that are more impactful, like running or jumping, as well as heavy resistance training, using exercises that provide loading through our spine and our hips, like deadlifts, squats, farmer's carries. Exercising such as just walking or swimming don't necessarily provide the same types of loading benefits for your skeleton. However, they can be good cardiovascular exercises, but just not as effective for specific bone loading.
What does the research tell us about resistance training and impact exercise for people with osteopenia or osteoporosis?
There have been a few different research studies looking specifically at exercise programs for osteopenia and osteoporosis. One specifically is the LIFTMOR trial, which was done in Australia, that looked at heavy resistance training for women with osteopenia and osteoporosis. This included 4 main exercises: jumping, deadlifts, squatting, and overhead press. And these were loaded and progressed to the point that they were doing 5 sets of 5 reps at over 80 to 85% of their 1 rep max. So lifting pretty heavy. And so this study showed that this routine done over the course of 8 months can not only reduce the decreasing rate of bone density, but can actually improve bone density over time.
A lot of people walk for exercise or feel like they're doing something good for their bones. What might be missing if walking is their only form of exercise?
Although walking can be a really great form of cardiovascular or endurance exercise, it doesn't provide that same level of impact throughout the spine and throughout the hips that can stimulate the bone cells to build more bone. So things that can make it a little bit more effective would be adding a weighted vest to give you that compressive force down through the spine, but it just doesn't have quite the same effect as some of the higher intensity exercises like running, jumping, or heavy weight training for that specific purpose.
For someone who wants to stay strong, active, and independent as they age, what would you want them to start thinking about today?
I think the biggest thing to keep in mind is we want to just stay moving and stay strong. There's lots of evidence in the research that shows that muscle strength and muscle bulk can actually really be protective in terms of our overall health as we age. So whether you're 30, 40, 50, 60, strength training can be adaptive and can be helpful for people of all ages in order to maintain their independence as they age and maintain that quality of life that they're really hoping to, even as they get older.
If someone gets a DEXA scan and is told they have osteopenia, what should they understand about exercise at that point?
With a diagnosis of osteopenia or osteoporosis, exercise is still really important to continue to do, especially exercises that can help load your bones to help stimulate the bone cells to build more bone, to increase that bone density and to try to prevent further decline into osteoporosis, there's studies that show that exercise, specific ones, can even improve your bone density as you go.
You're an avid weightlifter yourself. What are some of the important things for women when it comes to their fitness routine, particularly post-menopausal women, and modifications they could make to their workout that could perhaps be more beneficial to bone health long term?
I think the most important thing to consider is that we want to make sure that we're doing exercises that load through our spine and through our hips, and also we can add in through the arms and wrists too, including push-ups or planks. And then secondly, I think it's important to consider that we want to go heavy enough to really stimulate the bone cells to build more bone. And a lot of times, especially women, can be a little nervous about going heavier with the weights, and they might stick with a little bit lighter weights and doing more reps within a set. However, the research shows that the most effective exercises are going to be in that heavier range with fewer reps. So 5 sets of 5 reps of a heavier weight versus 3 sets of 10 to 15 at a lower weight.